You wouldn't think that people would suffer diseases associated with low levels of sunlight in our sun-drenched country with our great outdoors lifestyle, yet many Australians do. And the culprit could be low levels of vitamin D. Dr. Norman Swan soaks up some rays to shed light on the facts.
The sun's ultraviolet rays produce most of the vitamin D your body needs. But it's a double-edged sword. Too much sun can cause skin cancer, and too little can lead to vitamin D deficiency.
Our summers were basically spent down the beach, but now, of course, life is different because of John's melanomas. We've had to stay out of the sun, and I guess that's what's led to the vitamin D deficiency.
Sophie and John's story isn't unique. It seems that lots of Australians have vitamin D levels that are too low, and that has enormous potential consequences.
Well, good morning, Sophie and John. Thanks for coming in.
GP Dr. Larry Light routinely tests his patients for their vitamin D levels, and almost 80% of his patients over 60 are vitamin D deficient.
It's almost unusual to find someone over the age of 60 with normal vitamin D levels.
Dr. Light's approach to people like Sophie and John could well be on the money. Low vitamin D levels have been associated with an increased risk of colon cancer, schizophrenia, diabetes, multiple sclerosis, falls and bone fractures, not to mention heart disease. It all sounds too amazing to be true. But is it? And it's all for something that's not even a vitamin.
It's actually a chemical messenger, a hormone. Vitamin D is produced in your skin when it's exposed to ultraviolet radiation from the sun. It then goes through a series of chemical processes in the liver and kidney, where it's converted to its active form, the hormone calcitriol.
Now, the most important thing that calcitriol does is help calcium and phosphate absorption from the environment into the body, particularly important for strong bones and good muscle function. What we've found out, though, is that there are proteins that respond to vitamin D in just about every cell in the body, and vitamin D has effects in most tissues in the body.
In recent years, low vitamin D has been associated with the development of autoimmune diseases, such as type 1 diabetes. But Dr. Jenny Gunton and her colleagues have found a link with all types of diabetes.
It looks like people with diabetes are more likely to be vitamin D deficient than people in the general population. It's not clear why it covers all kinds of diabetes, but we think that vitamin D probably plays an important role in the function of beta cells, and they're the cells that make all the insulin for your body. The beta cells don't work as well if you don't have enough vitamin D. We don't know whether or not you can use vitamin D to treat diabetes, but it's a question that we're starting to look at. We're certainly treating people who we find to be vitamin D deficient, and it looks like it's helping their diabetes.
The real scientific test to see whether vitamin D is truly of benefit is to give it to people in a trial.
And a recent study has taken trials involving 57,000 people taking vitamin D supplements. And what they showed was that supplementation is associated with a lower risk of dying of any cause.
Well, I think vitamin D deficiency is becoming a public health issue. It's becoming incredibly common in people who are otherwise healthy.
The groups who are really at risk are the people who are older, people who have dark skin, the people who cover up, and anyone who's chronically ill.
Normal levels for vitamin D are a controversial topic, but it's very clear that if your levels are below 25, that it's very bad for your bone density and you have an increased risk of osteoporosis and breaking your bones. Up to 50, which is the current cutoff for normal, you still have abnormalities in calcium handling in the body.
So if you've got a low level of vitamin D, what's the best way to replace it? Sunlight's pretty good. 90% of our vitamin D is made by sunlight having an impact on your skin. But sunlight also causes skin cancer. Do we really need more sun?
Rebecca Mason and her team have made some remarkable findings. Getting your vitamin D levels from the sun can be safe and may also have a protective effect.
What we've shown is that vitamin D compounds used topically, both in human skin and in animals, reduces UV-induced DNA damage, and in animals reduces the immunosuppression and the skin cancers. We think that this reflects a natural protection in the skin that vitamin D is giving it.
Some experts recommend exposing 15% of your body to the sun every day for 6 to 8 minutes before 11 a.m. or after 3 p.m. and double this time during winter if you live in Tasmania or if you have dark skin. How does this sit with the Cancer Council's Slip, Slop, Slap campaign?
It's very important that the sun protection message during the summer remains, and the vitamin D message can complement it for times when the sun is unlikely to burn your skin.
But getting out into the sun at a particular hour of the day for just the right length of time is not practical for everyone.
I've had 2 melanomas and do my best to sort of keep out of the sun.
Here you go, John. Here's your cup of tea.
So, for people like John, supplements have their place. But what's the recommended dose?
The only supplements that are generally available here are about 1,000 international units, and most of them are in the vitamin D3 form, the same form as we make in skin. If you've actually got significant levels of vitamin D deficiency, most people now are recommending a loading dose of at least, say, 5 tablets a day for a couple of weeks, and then going back onto the 1,000 units a day.
Good news, your vitamin D levels have risen from the original 23 up to 82 nanomoles per litre. So taking those vitamin D capsules, I think it was 4 at night for about 3 months, paid off.
But what about diet? With only 10% of the vitamin D your body needs coming from food, is it a realistic source?
We don't get enough vitamin D from the diet unless you take supplements in nearly all cases, because you only get it from oily fish or cod liver oil. And I've never had cod liver oil, but I'm told it tastes memorably awful.
So if you just want the maintenance dose of vitamin D, you'd have to eat the equivalent of 1 large fillet of oily fish or 1 tablespoon of yummy cod liver oil every day.
I'll be taking vitamin D now for the rest of my life, 1 capsule a day, just to make sure that my levels don't drop and that I can get on with life.
So what are the main messages here? Well, a lot of us are low in vitamin D and we don't even know it. You can have your levels checked, but they're expensive to do. For some of us, just getting out in the sun for a few extra minutes a day, particularly for exercising, that'll be good. 15% of your body uncovered. Many people, though, are going to require supplements, sometimes in quite significant doses. So it's probably a good idea to have a chat with your doctor first.